Imagine you are 78-year-old. Your name is Margaret Lewis. You spent decades teaching children, raised three kids, and finally retired with just enough to cover your modest need. One morning, your doctor tells you that you need a crucial scan. It could catch cancer early, maybe save your life. You feel anxious, but you are calm because you join Medicare Advantage. The commercial promised better benefit, lower cost, and peace of mind. But when the hospital submits the request, the call come back denied. This isn't just Margaret's story. In fact, it could be anyone's. Today, more than 34 million Americans, over half of everyone on Medicare, are enrolled in Medicare Advantage. That's more than the entire population of Canada. Back in 2007, it was only 19%. By 2025, it's 54%. It looks like a triumph of modern healthcare. On television, the ads are everywhere: smiling seniors, free dental checkups, gym membership, even rides to the doctor. But the reality hidden behind those glossy images is that many seniors face denials, red tape, and unexpected roadblocks. The scale is enormous. Medicare Advantage is no longer a side option, it's the system. It now costs taxpayers more than $450 billion every single year. That's larger than the entire economy of Austria and more than America spends on many government departments combined. Yet this program isn't run by the government directly, it's run by insurance giant. For Wall Street, it's a profit machine. For seniors, it was supposed to be a safety net. Even the year's one number that tells the story. In 2022 alone, Medicare Advantage plans denied 3.4 million care requests. Millions of seniors told no, even though many of those denials were later overturned on appeal, meaning they should have been approved in the first place. Imagine waiting weeks for treatment only to find out it should never have been delayed at all. So when you see those smiling commercial promising more, remember the denials later stake on kitchen tables across America. The stakes couldn't be higher. For taxpayers, it's about hundreds of billions. For insurers, it's about record-breaking profits. And for seniors like Margaret, it's about whether they get just a trap hidden in fine print. Traditional Medicare left seniors exposed. It didn't cover dental, vision, or hearing. There was no cap on out of pocket cost, meaning one surgery could cost thousands. For a retired worker on fixed income, it was terrifying. Medicare Advantage filled that gap with perks. Behind the smile was a profit engine. Medicare paid insurers more for sicker patients through risk scores. This meant documenting as many conditions as possible, even borderline ones. The more diagnosis, the higher the payment.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
For seniors like Jackie Martin, the perk felt real. She got glasses, dental care, even transport. But the same system that gave her gifts could later decide which treatments she could access and which she couldn't. Medicare Advantage is massive, $450 billion a year, revealing the defense budget. Insurers don't get flat payments. Instead, they are paid more if patients look sicker. On paper, risk scoring sounds fair. In practice, it became a gold mine. Whistleblowers revealed pressure to inflate diagnosis. A patient with mild diabetes might suddenly be coded as a severe. Each extra label boosted revenue. The Department of Justice accused insurer of billions in overcharges. Meanwhile, patient hit another wall: prior authorizations. Even when doctor said care was urgent, insurer demanded extra approval. In 2022, 3.4 million requests were denied. Federal reviews show many denials were improper. The results: insurer posted record profit. Wall Street cheered, but seniors like Robert deny rehab after his stroke, paid the real price. Care delay is care deny. In 2022, Medicare Advantage denied 3.4 million requests. Investigator found many should have been approved. That meant lost time, lost treatment, lost lives. Margaret, the retired teacher, had her cancer scan delayed. By the time approval come, the disease advanced. Her family said, "We thought we bought peace of mind, but we got a system that failed." Robert's rehab was denied as not necessary. The approval come too late, so his recovery window was gone. Whistleblower said staff were told err on the side of number. Minority and rural seniors faced even harsher barriers. Black and Latino elders enroll at higher rates and face higher denial rate. Rural seniors discovered their only hospital wasn't in network. For the most vulnerable, Medicare Advantage wasn't a choice, it was a gamble. By 2023, regulators cracked down. CMS ordered audits and clawbacks. Insurer faced billions in repayments. Department of Justice lawsuit is giant like UnitedHealth and Cigna. Congress erupted. Supports claimed Medicare Advantage gave seniors choice. Critics called it profiteering. Hearing asked, is this a solution or a scheme? The stake: 450 billion plus annually. Half of seniors depend on Medicare Advantage. Wall Street profits. Seniors wait in uncertainty. Experts see three futures. First, audit fix the system. Second, trust collapse and senior return to traditional Medicare. And third, the most likely, insurers adopt. Reform drag, seniors stay stuck. The echoes are clear. AIG in 2008, UK car scandal in 2023. Different industry, same lesson. When profit grows faster than overnight, the public pays. For Margaret, Robert, and millions more, the real currency isn't money, it's trust.